Healthcare.gov is back up and running today. The Obamacare website was taken down several hours overnight as technicians worked toward an end-of-November deadline to fix problems with the site. Joining me now, Republican Congressman Robert Pittenger of North Carolina. Welcome back to the broadcast. Nice to see you.
Good to be with you.
So, sir, I know that you have been quite a vocal critic of Obamacare, and despite the recent website issues, there is a new poll out I want to share with you. It's by the nonprofit Kaiser Family Foundation, in which it shows nearly half of all Americans still want Obamacare to stay the same or be expanded. In fact, only 13% want it replaced with a Republican alternative. So is it time now for Republican opponents to work with the president to just fix the issues with Obamacare instead of calling for its repeal?
Well, I think we've tried to work with the president on numerous occasions. We've offered many reforms. They've been very resistant to change anything with it as of today. I will say to you that with the estimates that have come from the Congressional Budget Office, that the cost is unsustainable. With companies that are not hiring right now, they're not wanting to hire full-time people. This is a major concern out there among the public. So when you look at the real impact of Obamacare and the premiums that are going up 200 to 300%, and people's policies being canceled, 3.5 million policies already have been canceled. The Wall Street Journal says by the end of December there'll be around 10 million policies canceled. Those are real people with real needs and real families that are really struggling right now because they were not kept the promise that the president made. The president said if you want to keep your health care, you can keep it. And there will be ultimately 15 million or more people who can't keep their plan.
What about when your North Carolina constituents call and they say, sir, problem signing up on the Obamacare website? Do you discourage them from signing up, or do you try to help them with the process?
Oh, we stayed open during the shutdown so we could help them. We're there to help them. The problem is it's been an absolute disaster for the public to engage it. You know, they spent more on this website, the taxpayers did, than Steve Jobs spent on creating the iPhone. It's been a total collapse, and it needs to get running. You know, this entire model is really not a model that is going to work. People don't want or really need to pursue health care to sustain the requirements for funding it unless they have a health issue. And the only people right now that are pursuing the options in the website are people who have a sickness today. So that's why young people aren't pursuing it. That's why, as we look down the road, I think it's going to be very improbable that the funding component is going to be there. The insurance companies are certainly calling on that now. They're saying that the funding will not be there to allow for it to continue.
But, sir, when you look at the enormity of this project, and you look at projects like this in the past the United States has undertaken, I mean, these things don't just happen overnight. And I will tell you that I spoke last hour with Jonathan Gruber, who was the architect not only of Romneycare, which is what we'll call it there for the state of Massachusetts, but also was a key advisor to the president on Obamacare. And looking at this chart, he absolutely agreed with it. It came from information he supplied, where ultimately only about 2 to 3% of Americans, which numbers up to maybe 9 million, 6 to 9 million, are those who are going to have to buy potentially more expensive insurance than what they already have to meet the minimum standards as set by Obamacare. If those are the numbers we're talking about, then surely the vast majority of people are going to be better off.
Well, as of today, you have a vast numbers of people who are signing up for Medicaid, enormous amounts, and are not signing up for Obamacare. In Oregon, you have 0 who have signed up for Obamacare, and huge numbers have signed up for Medicaid. So I think as you look long-term in the sustainability of this program, it's very questionable. Max Baucus has said, you know, it is a train wreck, and he's come out even more recently saying that it needs a 1-year delay. This needs to be reviewed. These are important numbers. You know, Bill Clinton said a few years ago, the year and the days of big government are over. This is the biggest government program that we could ever conceive. And there's a huge gamble out there that the president's made that this nationalization of health care is really going to work.
Let's look ahead to what happens after the first of the year with the new budget deadline, January 15th, debt ceiling February 7th. Senate Republican leader Mitch McConnell says he will not allow another shutdown as part of a strategy to repeal Obamacare. So how might budget negotiations be different this time around?
Well, we need to be pursuing a long-term solution to our spending. whether you talk to Peter Orszag, who was Mr. Obama's budget writer at one time, or Paul Ryan, or Erskine Bowles, whom I've known for 20 years, they will tell you that unless we address the long-term spending in this country, we will collapse like Greece. And that has to be on the table. That has to be a leadership issue. President Obama, frankly, he never mentions it in his inauguration or his State of the Union. When he came to meet with House Republicans, we met with him an hour and a half, and he never even brought it up. Frankly, when we brought it up, he said, you know, I'm really not concerned about deficits and debts. That's a very difficult perspective. We need to recognize that these spending issues are important. We need to be on a balanced budget. We need to be focused on what is going to give a sound fiscal opportunity for this country.
But when we need to look at issues as well, I mean, you cannot ignore, sir, the problems that are on families on a daily basis now with the cuts to the food stamp program. I mean, look at your state alone in North Carolina. 1.7 million residents rely on these SNAP benefits. 73% of them are families with kids. Economists estimate that every food stamp dollar turns around and brings in $1.70 in terms of impacting the local economy, which means a total economic loss to your state of about $280 million in the coming year. Money that's no longer going out to farmers or grocers or others. So what's your reaction to that kind of impact on your local economy?
Alex, if it was that good, we would have a robust economy. As it is right now, our economic growth is about 1.8%. Our unemployment is about 7.5%. We have about 170,000 new jobs, 170,000 new jobs per month. That is very slow growth. You know, back in the 80s when Reagan cut the tax obligation, cut the regulation, we didn't have this enormous, huge burden as much of government programs. We were creating 300,000 or 400,000 and 500,000 jobs a month. That's real growth. That's a real opportunity for people's lives. Right now we have 47 million people on food stamps in this country. We are trying to at least go back to what Bill Clinton and Newt Gingrich did in having a work program. If you're able-bodied and you don't have children to have to take care of, you should be able to provide some form of work. We also have eligibility issues. People are able to go and subscribe to food stamps without hardly any requirements on eligibility.
Yeah, but with
that's not right.
Well, perhaps, sir, but, you know, with regard to the work requirement, I mean, you got to be able to find a job, and as you well know, it's pretty hard in many, many parts of this country. But nonetheless,
the opportunity needs to be there.
I do appreciate your time, as always, with this Republican Congressman Robert Pittenger of North Carolina. Thank you.